Nebraska lawmakers got to work in a rare special legislative session to try to fix the state's safe haven law. Across the country, similar laws allow states to take in unwanted newborns and infants, but Nebraska's law doesn't have an age limit. Since July, dozens of children, many of them teenagers, have been dropped off at hospitals in Nebraska. Karen Authier heads a nonprofit group that provides foster care and adoption services.
The legislation should be changed so that it applies to infants and that it takes care of what should happen to the child once the child is left at the hospital.
There's no consensus among child welfare experts on what age cap works best for a safe haven law, and Nebraska lawmakers are looking at proposals calling for different age caps. Lona Kramer recently dropped off her 18-year-old adopted daughter, who she says was becoming too difficult to control. She says lawmakers shouldn't restrict the law just to infants.
Sometimes I get the feeling that there's protection for infants before they're born and for the first few months maybe, because they're marketable. They can be adopted easily. And I think there needs to be some consideration of that and consideration of families as a whole.
Authier agrees that many families need more help than they are getting.
I do believe that when the legislature comes into full session, that the legislature needs to provide some better solutions, including some crisis intervention services that can sometimes mediate, sometimes provide a respite for parents, but in some way help parents navigate the mental health system.
Lawmakers have said they'll address the broader mental health issues during their regular legislative session, which begins in January. In the meantime, they could pass their emergency legislation as early as next week. Ross Simpson, The Associated Press.